But up next, we sit down with two state lawmakers who have direct experience in the healthcare field. They're here to discuss the debate taking place now on healthcare at the state legislature. The issues of healthcare, health insurance, and affordability have dominated debates at both the state and federal levels. In Washington, Republicans still trying to repeal and replace the Affordable Care Act. It has not been easy. Nobody thought it would be. And in Minnesota, questions remain about the future of MNsure and the overall stability of the health insurance market. So today we're going to discuss these issues with two lawmakers who have direct experience in the healthcare field. Republican Senator Scott Jensen is a family physician from Chaska and professor at the University of Minnesota Medical School, and DFL State Representative Jennifer Schultz is an economics professor at the University of Minnesota Duluth, specializing in healthcare policy. And it is a very complicated issue, obviously a lot of moving parts, both in Washington and here in St. Paul. But Senator Jensen, I want to start with you about something we talked about a couple of weeks ago on the Senate floor when we had a conversation about this. You were concerned that too much of the conversation, both in Washington and here in Minnesota, is about the cost of insurance and not the root cause of why is the cost of health care going up so dramatically year after year. Do any of these bills we're talking about in Washington or Minnesota address that issue adequately?
Well, I think it's really been all about relief, reform, and if you will, access. And we had to dig into relief right away because the crisis was there with the premium increases of 60%. But now we've sort of come full circle, and we've talked a lot about how to pay for insurance, and it's now time to talk about cost, which is a representation of the amount of services times the cost, times their cost. And we just haven't really dug into that. If you go through the grocery store, you're going to have items in your grocery cart. You look at each item, the cost, you multiply it out, that's your cost. We've gone from 5% gross national product in the 1970s to almost 20%. The cost continues to rise, and we can't afford it. So we have to talk about how do we help people reduce the cost. All of us have to roll up our sleeves and work together on this.
And you're an economist, so you know that as the cost of the service goes up, well, the insurance has to go up with it. And I know when the Affordable Care Act was passed, a lot of people thought the reason it was called the Affordable Care Act was because it was going to bring health care costs down, health insurance costs down. That didn't happen. Are we doing enough to address the root cause of why health care costs go up?
Well, the primary objective of the ACA was to make sure people have access to health care through increasing health insurance coverage. So that was the primary objective. There were some pilot projects to address the health care cost growth, and we haven't really done that in our state or at the national level. And we need to get on board and address the underlying cost growth of health care. And that means we have to fix how we pay for health care. It's really the prices that are higher compared to other countries, and we need to fix how we pay providers.
So we haven't addressed that yet, so what we're left with, at least for this year, both in Washington and Minnesota, is trying to address the insurance side, the cost of insurance side. Reinsurance is one of the ideas that Republicans have floated in both the House and Senate, and they have passed that. Where do you stand on the issue of reinsurance, which is essentially a pool of money being given to, available to health insurance companies to keep them in the market and to keep costs down? Well,
we need to do three things. We need to stabilize the individual health insurance market. We need to make sure that people have affordable health care coverage in that market. And we need to make sure that they have access. The reinsurance bill that's currently being evaluated spends $600 million from various funds to give to health insurance companies with no guarantee that they're going to meet any of those three objectives. So we don't have any guarantee that they're going to offer coverage in the individual market, so we don't know if it will be stabilized. We have no guarantee that it's going to be affordable coverage, and we have no guarantee that it's going to provide access to health care providers, because people are complaining about limited size of provider networks and not being able to go to their local hospital. And that does none of those things.
And Senator Jensen, that is a legitimate concern. If you're going to have hundreds of millions of dollars available to these health insurance companies, shouldn't there be some assurance about how that money is going to be used?
I think so. I think Representative Schultz said it well. I agree. And I think that Governor Dayton said he wants a reinsurance piece. And I think Democrats and Republicans alike have indicated that somehow we have to stabilize the market. And until we do that, we're going to have a hard time digging into the actual cost. But I'm concerned also that the major insurance carriers have not committed. And so that's why we have to look at all the options.
And one of those options is a Minnesota Care buy-in that Governor Dayton first proposed, and now Democrats in the House and Senate have also come out with proposals for this. Where do you stand on that? Essentially, explain to people briefly how it works and why you think that should be a component of the solution.
Well, this just allows people to have another choice of a health option, a product. It's not Minnesota Care. People don't see that when they go and enroll online through MNsure. They just see it's a Blue Cross Blue Shield product or Health Partners product, and we want to make sure people have the ability to buy into those products. So they would be paying full premiums, and our estimates from MMB suggest that those premiums will be about a lot lower, about $800 a year lower than what's currently on the market. And the administrative costs for Minnesota Care is about 3%, which is a lot cheaper than the administrative costs currently at health plans. So it gives people, it meets all those three objectives. It would stabilize the market because you have a choice of products. It would be more affordable, and it has better provider coverage and networks across the state of Minnesota. And it does a fourth thing, is that there's a pool of 1 million people we could take advantage of as the state that could lead to reforms on addressing healthcare cost growth.
Now, most Republicans have voted this idea down in both the House and Senate. You voted in favor of it in the Senate, but you still have some concerns about it.
I supported the amendment that night as well as the reinsurance bill, and I think simply we need to look at all the options. Republicans and Democrats in a bipartisan fashion, we need to look at all the options, and that's where that's coming from. I think the problem with the MNcare buy-in piece is we're doubling down. I mean, a lot of the same promises you're mentioning were ones we were given with the Affordable Care Act, and it didn't work out so well. So I think it's difficult for a government program to operate on a level playing field. They've always got that safety net, and they don't have the same obligations that the major insurance carriers have. So when I decided to support that amendment that night, that was at least as much as anything to broaden the narrative. We can't stop now. We have to provide access to everybody in every one of the 87 counties. The massive Washington overreach really is dismantle one of the best beacon healthcare systems in their country. Minnesota was one of the lowest in terms of providing, in terms of people not being insured. We had low insurance premiums. We had a lot of good things going for us prior to 10 years ago. And we've been undercut. So now we've got to roll up our sleeves together, Democrats and Republicans alike, and dig ourselves out of this.
And Representative Schultz, on the Minnesota Care buy-in, there is concern among Republicans that it's just growing a public health insurance program. It'll be competing against private insurance companies. Should any of those things be a problem?
That's not true. They're offering private health insurance products. Minnesota Care, there is no public program. These are private health insurance providers offering plans through Minnesota Care. So I think we just have to get through some of those myths. And, you know, everything wasn't great before the ACA in Minnesota. We had 10% of our population who were uninsured, who cannot afford access to health care, and now it's 4%. So we've made a lot of progress.
So less than a minute to go. Where do we go from here? How do you think the House and Senate are going to eventually come up with something? Because something has to be done before the session's over in May.
Tom, I would probably take issue with Representative Schultz on that. I don't think that the private and public are on a level playing field, and the public option isn't selling private insurance. They play by different rules. They'll reimburse at different rates. So I don't think that's quite right. I think we need to start sharpening the focus on actual cost reform. And I think the Republicans are committed to it. I think the Democrats want to do it. And in the next 2 months, we got a lot of hard work to do. But one way or another, we got to get back to the Minnesota people saying, it's going to be affordable, you're going to have access, and we're going to get this job done.
Representative Schultz, final word.
I've heard that before from our president, and what's happening at the federal level, they're breaking all those promises.
Which president?
So there's no guarantees. President Trump. So I'm really worried that what's happening at the federal level is going to hurt Minnesota. We may lose a lot of people who currently have coverage, may not get coverage.
All right. Well, there are no easy solutions. We didn't solve the problem in our 8 or 9 minutes here, but we did our best to at least explore the problem. So I appreciate Senator Jensen, Representative Schultz for being here, and best of luck to you. You've got a couple months to try to iron something out. We'll be back with political analysis in 2 minutes.